In today's Wellness Wednesday, June is Men's Health Month, encouraging men to head to the doctor for regular checkups and raise awareness about preventable health problems and early detection. Joining me this morning is Dr. Robert Jackson from St. Luke's. Doctor, good morning. Thanks for joining us this morning.
Hey, good morning. Happy to be here.
Okay, well, first question for you. Why is placing such an emphasis on men's health so important, not just this month, but every month?
So that's a great question, and the answer to that is that there is a real disparity for health in men in America. There's a quote by a physician I like who's a men's health specialist that says that there's a silent epidemic in America, which is that men live sicker and die younger than women. And there's actually quite a disparity. So the average man has a lifespan that is 5 years less than the average woman. And for all of the top 10 causes of death in America, for 9 out of 10. So for cancer, for heart disease, for lung disease, for diabetes, men are afflicted by those diseases at a much higher rate than women are. And those disparities extend even into mental health. So men are 4 times more likely to commit suicide than women. So really kind of across the spectrum of health, from physical health to mental health, men tend to do more poorly than they should, and tend to do more poorly than women do. So it's something that needs attention and something that's important.
Gotcha. Now, aside from the perhaps comical and arguable fact that maybe we just do more stupid things, why do men seem to have more health issues than women?
Well, statistically, there actually is part of it that we tend to do more stupid stuff. I mean, men do tend to take more risks, which is kind of one of those stereotypes. But a big part of this, I think there's 2 parts of this that are important to talk about. One is that women are 100% more likely to seek preventative care than men. So men just do not seek preventative care. We kind of tend to just go to the doctor if there's something wrong. And so if you feel like everything's fine, you may not go in. And so you may miss the chance to become healthier or to prevent problems later by not addressing them initially, because you just figure you'll get to it down the road. And then the other thing is that culturally, for some people, they feel like kind of being manly means, taking care of things on your own and maybe not seeking care when you should, and just kind of toughing it out, which in the end has some real negative long-term consequences.
Gotcha. Just like we won't ask for directions as well. So we're going to skip ahead just a little bit. What should motivate men to seek this healthcare regularly?
So I think the thing that should really motivate men is to take a look at, what it really means to them to be a man, what it really means, what their identity means to them. Because for a lot of men, that involves taking care of the people around them. It involves helping to support their families, their parents, their kids, their spouses. And to do that, you really have to be healthy. And so I think for men, when they think about this, if you think about who you want to be, if you think about the impact that you want to have on the lives of the people around you, you've got to be healthy to make that happen. And to be healthy and to be able to continue to be healthy throughout your lifespan, you need to see physicians. You need to get in and get preventative care. Make sure that you're doing well now so that you can continue to do well in the future.
Perfect. And otherwise, guys, don't be selfish. Do it for the ones you love. Now, we're out of time, Doctor. So last question, where can people find out more information?
So if you go to St. Luke's and search St. Luke's Men's Health Clinic, we have a clinic that deals specifically with these issues. And then online, there's an organization called Men's Health Network. And if you just Google that, they have fantastic resources and a lot of information about Men's Health Month and men's health in general.
Perfect. Dr. Robert Jackson from St. Luke's, thanks for joining us this morning.
Thank you.